Good afternoon, everyone, and welcome to another episode of Sunday House Call. We have my good colleague, Dr. Sinara Kumar, with us again, and welcome back.
Thank you. Thanks so much
How
for having
you
me
been?
again.
We didn't see you last week, I think.
I know. Thanksgiving time was a busy family time, but
I
it was
hope
fun.
you had a good Thanksgiving.
It was a good one. Gained a few pounds. It's all good.
So, just because of that, I actually received so many emails saying, Sinara, you know, it was Thanksgiving, I gained some weight, we're going to all the Jewish holidays and Christmas and New Year.
Right.
What do we need to do to lose some weight? So you tell me like some of your secrets, and I'm going to put up like some of the lists that I made. What do you usually do? Of course, you always stay in good shape, but besides exercise, anything else that you do to make sure you don't gain enough weight?
I mean, activity is so important. I mean, fortunately, I have a 7-year-old and a 1-year-old, so they keep me plenty active. But activity is really important. Certain types of exercising is really important. But your diet is really important as well. And the minute I go off my diet, I'm one of these people that if I sit next to a cheesecake and smell it, I'm going to gain 10 pounds, right? So I have to watch what I eat as much as possible. I mean, I definitely go off the scale here and there, but definitely I try to watch what I eat.
So portion control. So
much.
Yeah, you know, I looked at a lot of data and I tried to kind of like dig out all the good stuff, and also a very easy list for everybody to really like keep their weight, maintain it. And it's not always about exercise. Sometimes exercise, of course it's important, but sometimes it's hard, they don't have the time. I want you to take notes, at least from my list, and this doesn't have to be the list, but it's one that really works for a lot of my friends and patients, and I certainly think that you can learn from this.
Right.
The first one is exactly what you said. Let's put the list up and you can learn from this. Exercise, exercise, exercise. As you said, it's very important.
Right.
So,
and certain types of exercise are important for increasing your metabolism. So weightlifting is important. Not necessarily bodybuilding weightlifting, but at least doing some sort of weightlifting to increase some of your muscle mass, because your muscles burn more calories than your fatty tissue. And the other nowadays is so popular is the HIIT training, or the high intensity interval training, which you can do on a treadmill. You can do it running through the park, where you do walking for 5 minutes or 1 minute, then you go to jogging, then you go to sprinting, then you go back to walking and jogging, sprinting. So that high intensity interval training where you're hitting it hard, but it's not a constant 30 minutes of hard intensity.
I think even if you devote and you don't have the time, 3 times a week, 30 minutes of treadmill or walking, or get some sort of trainer to help you with this. So this way you have a dedicated time for yourself to do it is absolutely important.
Absolutely.
As we get older, we lose the muscle mass. That's important to control your diabetes and your sugar and all of that things. And also you prevent osteoporosis as we get older. So I think that's really, but to maintain your weight, that's the minimum you should do. And everybody should have an hour and a half of their time. The second one is, this is a whole list of A, B, C, D. So B is for breakfast.
Yes.
And we've talked about this on TV all the time. And I think when your mom said that breakfast is the most important food of the day, they were absolutely right. Because you break the fast and you get all your energy.
Right. You have to put fuel into the car to get it going for the day. And it is so incredibly important. You want to make sure you add some protein into that breakfast, so you don't want to necessarily just eat all cereal or on a daily basis eating cereal. You do want to try to put some form of protein into your breakfast, and actually into any of your meals. But yes, breakfast is very important.
I think you break the fast, you increase your metabolism.
Right.
You get not only like start all the food that helps with your concentration and your ability to do better, but when you starve yourself, you're going to dig into your reserve, which is your fat, and you start burning that. And when you starve yourself and then you get to lunch and you're hungry and you're going to take a big meal, all of that goes back and become a body fat, and it actually works against you. So having a healthy breakfast, you know, oatmeal, any kind of berries, all these antioxidants is absolutely a great thing for you.
Right.
C is coffee.
Right, or caffeine.
Okay.
Caffeine is really good is really good for increasing your metabolism. And a lot of those energy or diet medications that they sell over the counter really contain caffeine in them as part of their combination. Not that I'm promoting doing that, because those can be actually quite dangerous for you if you're not able to tolerate those types of medications or chemicals that within those. But but caffeine is important. You can do it with coffee, but other forms of caffeine like green tea or oolong tea are probably a little bit healthier.
We'll get to green tea in a minute. But so C stands for coffee, and the reason why I've talked about this forever, And at the beginning, people, all the medical doctors were coming after me saying like, oh, coffee is not good for your heart and your reflux. Obviously, if you're a pregnant woman, obviously if you have like high blood pressure, that's common sense and you want to stay away from this. But there's a vast number of research that's coming out of the pipeline for years that talks about the fact that if you have 3 to 4 cups of coffee a day, about 8 ounces, it can reduce the risk of diabetes, it can reduce the risk of prostate cancer, Alzheimer, multiple sclerosis, and on and on. Obviously, you talk to your doctor and find out if it's good for you.
Right.
Now, what's interesting about coffee is that it's not the caffeine. It's all the polyphenols, it's the magnesium and chromium and ascorbic acid that actually helps with all of these diseases and weight loss. And that's really important. So if you want to have decaf, that's perfectly fine. The only thing I usually tell my patients is don't add too much sugar. You see some of the American diet people like pouring sugar in this thing.
Well, you get it from the cart, right? And then in New York City, we get it from the cart. We want it regular, which means regular with a bunch of milk and sugar in it.
That's true.
Which is not good.
So that's not a good thing for you. So you want to be careful because all that milk is cholesterol, etc. And I also, as a urologist, I tell them, because it's a diuretic, add at least 1 or 2 glasses of water along with coffee because it can run out. So we got A, B, C, and then D is the diet, which I know like you've talked about it, but go ahead.
Right, you really have to eat healthy foods. You want to try to keep it to a good portion of it being proteins, minimize the unhealthy fats in your diet. Carbohydrates not necessarily bad, but those processed carbohydrates are really what get you. But as long as you're keeping that in proportion with the proteins. But I think the other key component to this is eating, as you kind of talked about this a little bit earlier, is start early with a breakfast, but eating every few hours with a small meal is actually better than eating 3 large meals a day. So if you're able to find a way to do that 5 to 6 small meals a day, that actually really improves your metabolism because it keeps your body's metabolism going. When we eat, we actually increase our metabolism.
I love what you just said because I think people need to pay attention to this. The way we were when we were in Europe, and I lived in France and London for many years, is that we ate all day long, and yet we kept our health and our weight was in order. Here, what you do is you have some breakfast, you don't have anything else, big lunch, and then you go to dinner and you just want to kill yourself because like, you know, you've been working hard, you're tired, and you just have a big meal, and immediately you go to bed, and that's when you start gaining a lot of weight. So I think what you said was very important. Small portion control, but have them every couple of hours. And I think that's the reason why this is important is you basically keep your sugar level at a very steady level. So you're not going through this like swinging sugar level that starves you.
And causing these surges of insulin, which actually cause you to store fat.
That's a very important point. So E, you wouldn't believe what E stands for. Early sleep.
Yes.
And I think sleep, everybody talks about like getting your 7 hours of sleep. And how many hours of sleep are you getting?
You don't want to know. It's about 4 hours of interrupted sleep with my 1-year-old.
And yet you're in good shape. So this is not what you want to do.
You do not want to do this. Look at the bags under my eyes. You do not want to do this.
So the reason why sleep is important is because, of course, when you're sleeping, all the work that you've done during the day, all the free radicals, it gets wiped out and gets cleaned up while you're sleeping, so you can concentrate better as you wake up. The other thing is when you don't get enough sleep, and we're talking about the REM sleep or deep sleep, your hormones, there are 2 things that's important. One is ghrelin and one is leptin. And ghrelin is the hunger hormones. When you don't sleep enough and you wake up, your ghrelin is up and you're starving. And what's the first thing you want to do? You pass Starbucks, you pass like Dunkin' Donut, and I love them. It's not a criticism of any of these brands, but you get there and you just want to have that sugar and bagel and donut. And that's your brain is telling you you're starving, eat the damn thing.
No, that's exactly right. Sleep is actually one of the best healing things that we can do for ourselves. Actually, your body heals so much during sleep, and that's including from injury, from surgery. Sleep is so incredibly important for our bodies, and it's very, very important for maintaining weight.
All right, let's put the list up again. So we covered the E. F stands for fiber. And I think fiber is, a lot of people don't get it. It's like, how the hell do I lose weight by having fiber? Give me a break. And the reason why fiber is important, obviously, is the filling, and there's a soluble and insoluble, but the insoluble fiber is the one that goes through your system and gets to the gut. And the gut is where our friends, the good bacteria that we've spoken about all the time, they're living there.
Right.
And that's important to reduce your inflammation, reduce all these chronic diseases, and one of them being obesity. So fiber is important, and I know you recommend it to your patients.
Yeah, no, fiber is very important because it also fills you, so you don't eat as much when you're including fiber into your meals. And in addition to that, it keeps your insulin levels actually also maintained or your sugar levels, I should say, maintained at a steady level. And that's very important, and that's what fiber does, because it doesn't create this sugar surge in your blood system as well.
I think like having at least 3 to 4 servings of fruits and vegetables is absolutely important. So far, it's not so bad. Hit the gym, start your breakfast, get your coffee, make sure you sleep well. All of these things are important as we're getting close to the holidays, where you have so many parties and everything else that's going on. Finally, you mentioned G, which is green tea. And there's, my God, so much research about green tea and the antioxidant and, again, polyphenol of this.
Right.
I don't know. I haven't like really found the right taste for green tea.
Yeah.
Some people like it, some people don't, but I know it's really important. Do you drink it, or do you like it?
I like it. I don't drink it a lot, but I do like it. But it does have so many health benefits in regards to antioxidants. It does have a little bit of the caffeine in your system, which does help your metabolism as well. So, and it's an anti-inflammatory agent. So it is actually really, really good. But you're right. I just haven't gotten into a habit of constantly drinking it like we should.
I think if you can form the taste of it and you like green tea, even having like a cup a day is actually great for you. And my God, the list of the things that green tea can help you with, it's important. My favorite one is water, H. And water is important because 60% of our body weight, it's all water. It's important for all the communications of the cells, keeping them well hydrated. It's amazing how much water you lose from sweating, from digestion, etc. So water is essential. And again, when you say as a urologist, start drinking 6 to 8 glasses of water, they're like, oh, I'm going to be always in the bathroom. But that's the key. And of course, it's very important.
Actually, they say if you drink 6 to 8 glasses of water a day, or I'm sorry, 8.5 cups of water a day, which when you think about those bottles, a bottle actually has 2 cups of water. So if you do 3 regular-sized drinking bottles a day, you're probably getting most of your intake in. But if you drink 8.5 cups of water a day, you actually burn an extra 96 calories per day.
There you go.
So
you have it. The concept of like losing and calories by drinking water. And then finally, I, which is something that not too many people talk about, is really input of organic food.
Right.
The type of food that you put in your system. And this is the time that we're going to get to all the fast foods and canned food. Stuff that has so much salt. We just last week talked to Dr. Rosenbluth about like high blood pressure, etc. Invest your money in buying something good, something like, that's organic, doesn't have all the pesticides, because that's what really causes all the inflammation and leads to inflammatory bowel disease. It increases obesity, and that's how you gain weight.
Right.
So
I learned this from you. I think it's incredibly, I think it's great information. I wouldn't have thought necessarily that pesticides could actually change your metabolism or not help your metabolism. So I think that's great information.
If you would have talked to me a few years ago, I was a little skeptical about this organic food. You buy something on a regular store would be like $3. You go over there, it's like 10.
Right.
And people like used to email me like, I don't have all the money to buy this kind of stuff. I have kids. But I think when time allows, if you really like look at the ingredients, see what's in it or not, you will see a lot of those pesticides are not there in organic food. So I think it is, yes, good food in America, could cost money, but then again, you stay healthy and you don't have to spend it on doctors and hospitals. So just to review very quickly, get active, eat your breakfast, coffee, diet, early sleep, add fiber to your diet. If you want to have a cup of green tea, I think it's important. Drink a lot of water and get yourself some organic food. I think that's a great recipe.
Does that include organic Christmas cookies? Because you can get those.
Is that right? I didn't know that. Okay, so that's good.
But you want to stay away from the cookies. You want to minimize the cookies and the cakes and the processed sugar and the high sugar. That's the worst you can do.
Once in a while, it's okay because the holidays are coming up, but you got to watch what you're drinking. So hopefully that will help to lose a few pounds, etc. Now, we
That's
got
right.
some questions from you
Yes.
over the last 2-3 weeks, and I just didn't get a chance to answer them. Today, we want to make sure that we clean up some of the questions that came up. So, Sinara, maybe you can read the first one.
I will. Well, actually, most of these are directed towards you, Dave, which is great because it's good information for all of us. This is from Alex from New Jersey, and he says, I'm a 54-year-old male with elevated PSA. I've had multiple ultrasound biopsies of my prostate.
Yeah.
What is the role of the MRI fusion biopsy?
So, you know, when we're talking about a young man like this with an elevated PSA, a lot of times what happens is, you know, they get a biopsy and it's a random biopsy, and the cancer actually could be there, but it could be on the anterior part of the prostate, or the biopsy could easily miss this. Typically in our office, we used to use an ultrasound technology to do the biopsy. So the patient will come in, they have taken some antibiotics, I use the ultrasound machine, and we would take images, and maybe if we have an image of an ultrasound, you can see that over here when we're taking these cores of biopsy, the actual lesion could be an area where the needle could absolutely miss this. And so the patient goes through multiple of these biopsies. There's no cancer, he's happy, but the PSA continues to go up, and that's a huge problem. Recently, what has happened in our office, and we were one of the first centers in New York City that started using the images of MRI, which is really important. So patient will go in and get a 3 Tesla MRI, and we have some images to show you, where they would take the images of the MRI, and then we can see, there's another picture where it can show you the lesion on the MRI exactly where the cancer may be. And based on that, we can combine the images of ultrasound and the MRI. And for example, you look at this MRI image and you can see where the arrow is. That's a suspicious lesion that normally on ultrasound you don't see it. So on one side is the ultrasound, on the other side is the MRI. So our technology has really improved. Now what do? We take the images of the MRI, and the computer, the image that we just showed you is a picture of the MRI fusion machine, combines these images, and then you can see exactly where the target is. And now, you know, you do a targeted biopsy. Now, not every urologist has this, so when you go for your biopsy, you want to make sure that it's a real fused MRI biopsy. That's really important, because with ultrasound, you can miss this. And the other thing is that the old-fashioned ultrasound biopsy used to find a lot of low-risk prostate cancers, which that may or may not really kill you, and it would just, you know, make the patient very nervous. They would upset them. Oh, I have the cancer. Once they hear the C word, but there's different type of prostate cancer. As you know, there are some moderate risk, some aggressive ones. What this MRI shows is mostly moderate and aggressive prostate cancers, which is really need to be treated. So what I will tell Alex is that, of course, like, you know, there are a lot of great institutions in New Jersey. We're here in New York. Always is important to get a second opinion.
Yes.
You can bring in whatever biopsies you've had. Maybe you understand that it's negative, but you may have an atypical cell, or you may have something called high-grade PIN. Those are suspicious lesions that may or may not lead to prostate cancer. We would study all of that. We look at the trend of your PSA, and then I would get the MRI after the examination and decide what to do. So I think, you know, the other thing, Sinara, you've heard of something called 4K test. It's a special blood test that combines 4 different types of PSA. And there's also a urine test called PCA3. So we add all of these components, and then you make it's like a detective work. Should someone get more biopsies or not, etc. And that's how we'll do this.
Technology has changed so much for your field, and obviously for the benefit of the patients.
Isn't that the same also, like in your field of breast cancer? Aren't you guys using
imaging,
more
yes,
MRIs?
Absolutely. Now we use MRIs almost routinely for patients, especially patients that have dense breast tissue or have a diagnosis of breast cancer. But I find, you know, for similar reason with patients that come to my office, if I feel a mass, I may or may not go ahead and do that biopsy. I usually try not to do the biopsy initially. I rather either do it as an ultrasound-guided biopsy, or I will send them to a radiologist to have it done as an ultrasound-guided biopsy, because at least you can see the needle going into the mass, taking a sample and coming back out. Whereas if you're doing it just on feel alone, which sometimes we're kind of forced into that situation to do it that way anyway, But when you're just doing it based on feel, you don't know where your needle is making contact.
You can miss it.
So the imaging is just so important, and it's so great to hear that so much has changed in prostate cancer diagnosis.
Well, it's what's interesting, and we've spoke about this. Your field of breast cancer and our field of prostate cancer, they go parallel,
Yes.
hand in hand. Not only the numbers, but also the diagnostic tools are becoming more and more sophisticated. So ask your doctor. Do you have an MRI fusion biopsy? Is that what you're going through, or any kind of biopsy? Let's go to the next question,
Okay.
Sinara.
The next question is from Ryan from Brooklyn. And Ryan asks, I had my prostate removed 3 years ago. My PSA was always 0. Recently, my PSA started to climb up. Should I worry, and what do you recommend?
So this is actually a very important question that I see this even in my own practice, that when you have done surgery, you have removed the entire prostate.
Right.
And then the patient, comes back a year or two after, goes, doctor, why am I following up? You already removed my prostate, or why are you checking my PSA? It's an interesting question. It makes sense. But what you need to know is that even if you have removed your entire prostate or prostatectomy, your cancer may come back.
Right.
And if you look at the diagrams that we have, after radical prostatectomy, your PSA should always be 0. So you can see the curve is going to go all the way to the level, and it should be undetectable or 0. And as long as your PSA is 0, you're cured. There are times that you may have a very aggressive cancer. You may have a Gleason 8 or 9 or 10. Or you may have what we call a seminal vesicle invasion, or it could be a T3 disease. In those cases, there's some likelihood that the cancer may come back, or you may have cancer in your lymph nodes.
Right.
On those patients, we always examine you. You need PSA follow-up. And if your PSA reaches 0.2 or so, that's when we start thinking about perhaps there's recurrence. You may need some form of radiation. Now, what's interesting, Sinara, is that a lot of people also may or may not know this, but you can give a low-dose radiation after surgery, but once you go for all these cyber knives and all these radiations of the world,
Right.
if the cancer comes back, surgery would be extremely difficult and challenging.
Right.
So surgery after radiation is hard, but radiation after surgery is feasible. It's a low-dose radiation, works really well. So my answer to, I think, Alex or Ryan was, make sure you follow up your PSA. Make sure you get a second opinion, and if your PSA is coming back up, then we need to treat it.
My dad had prostate cancer back in the 1990s, and
I didn't know that, actually.
Yeah, so he had I think he was relatively early stage, relatively early grade, but he ended up having a radical prostatectomy. And so for years afterwards, he would get his PSAs checked, and he would see increases in his PSAs. Of course, he'd get very anxious about what that all meant. But you can see fluctuations with up and down, right, with the PSAs going up and down. Does that mean anything when they're going up and down?
Well, when people talk about the fluctuation of PSAs, mostly happens when they have their prostate. And that's not when they have prostate cancer. So typically, you may see an uprise or lower and down. Number one, anytime you get your PSA, make sure there's no sexual activity for 24 to 48 hours before getting that test, because that's one of the things that can actually increase the level of PSA.
Right.
But inflammation of the prostate, enlarged prostate, or depending on any kind of trauma, or that PSA can go up. Now, after surgery, if you have removed the entire prostate, PSA should be 0. So in your case, of your dad's case, if the PSA is climbing up, we need to see him. We need to make sure that we get a bone scan and get a CAT scan, restage him, and find out if there's any cancer outside, and then treat it very aggressively. And they end up doing very well. Okay. Depending also what kind of cancer he had. So,
can a rectal exam cause an increase in a PSA when you've had your prostate removed?
It's a good question. No, after it's removed, it should not cause any increase of PSA.
Okay.
Some people talk about, should I get my PSA right after the doctor did the exam? And unless they do a very aggressive prostate exam, it should not really cause the rise. So I wouldn't worry about it. And that's $25 copay for your dad and all the consultation.
I'll be sending him in to you.
All right, let's go to the next question.
All right. The next one is from Mark from Baltimore. He said, I saw blood in my urine with no pain. What do I need to do? Is it serious?
So this is also another good question that comes up all the time. And not only we can see this in men, but also women sometimes see blood in the urine. And what you need to decide is this a painless, what we call hematuria, or painless blood? We have a video that we can play you, and then we'll come right back. Let's see what the video says. So, you know, a lot of times when someone comes with blood in the urine, you want to make sure that you check the kidneys, because it could be coming from the kidney. So typically as a urologist, we look at kidney cancer, kidney stone. Obviously smoking is a major risk factor for blood in the urine. And for the upper tract, I always try to get a CAT scan, as we saw in the video. And then of course in our field, I do what cystoscopy in the office, which is like taking a look inside the bladder. And it's amazing how much information we get. And we're looking for bladder cancer and making sure there's no stone or bladder. This is a picture of what we do in the office, is cystoscopy. It looks awkward, but it's not really painful.
Right.
And people sometimes freak out, oh my God, like, you know, you're going up with a scope. But it's the same thing as colonoscopy. It's the same thing as having a stethoscope on someone's heart. We get a lot of information about how big the prostate is, how much obstruction, is there a stone or bladder cancer, and in 5 minutes, we can actually save your life. Last week, I had a patient that, you know, we had a discussion, and he was on aspirin, and his doctor kept saying, like, oh, you're on aspirin, I'll give you some antibiotics, and you send him home. Oh, and he came in, and I said, look, the yield of looking in and finding bladder cancer is low, but it takes 5 minutes to do this. And guess what? We take a look at the picture, and this is what this poor guy has in his bladder. And you can see the lesions that are like papillary or cauliflower looking. And that's a typical picture of a superficial bladder cancer. And, you know, of course, you know, ended up discussing with him. And what we usually do, Sonara, in a case like this is you take the patient to the operating room, you shave off all that tissue, and you get a stage of what the bladder cancer is.
Right.
A lot of times it could be superficial, and we may not need to do any, like, you know, further treatment, or they may need some chemotherapy inside the bladder, but you save someone's life with this.
Right.
You know.
I think bladder cancers are usually, at least in the United States, diagnosed relatively early. Obviously, they require treatment so that they don't progress, and you have to worry about recurrence. But what are some of the risk factors, David, and the causes of bladder cancer?
Well, age is certainly, like, you know, age over 40-year-old, that's like one of the risk factors. Smoking is number one, and if you're smoking, try to quit if you can. That's like with everything, not only for emphysema and bronchitis, etc., but bladder cancer is a big thing. Sometimes people have had chemos like cyclophosphamide. That's one of the things. You know, believe it or not, a lot of the chemicals that we use in hairsprays for women and other chemicals in the environment can cause like bladder cancer. But the most important thing is not to ignore this blood in the urine. Sometimes it's microscopic. You go to the doctor, they check the urine, and you may not see it, and sometimes you may be able to see it. Now, people have told me, like, I have my menstruation, you know, maybe it's my hemorrhoid. They look for everything else, or I'm on aspirin. But this needs to be checked. Along with the urine, we also send urine cytology to see if there are any cancer cells that are shedding. And then finally, besides cancer, in women, we see a lot of people that may come with cystitis. They may have urinary tract infections. Now, that's mostly painful.
Right.
So then you send a urine culture and you treat them for urinary tract infection. But the other most common thing that we see as far as like blood in the urine is kidney stones.
Right.
And kidney stone, unfortunately, we're not going to have a lot of time today, and maybe next week we'll talk about this. Yeah. But kidney stone is also one of the diagnoses, and that can cause blood in the urine. So by getting ultrasound or non-contrast CAT scan, you take care of the kidneys. By doing a cystoscopy, you take care of all the prostate and the bladder, and you can save someone's life. Very easy, and we'll talk about more kidney stone next week, perhaps.
Right. The bottom line is don't ignore it.
Don't ignore it.
See a urologist, specifically you, Dr. David Samadi.
It's incredible how fast. I think we're out of time.
I know.
we're done. That's they're telling me that we're out of time. So
Oh.
I hope that recipe of maintaining your weight is helpful. We'll be with Dr. Sinara Kumar next week. It's always a pleasure to talk to you about all these medical. And I can't tell you how many emails and messages I get about, like, people love it. There are so many people at Midwest that don't have doctors, they don't have insurance. And so send us your questions. We'll answer them with Dr. Kumar every week, Sundays at 12:30. If you're a doctor, you're a professional, you're nurses, holistic medicine, or whatever you do that you want people to hear from you, send the email to us and we'll be our guest of show, and both of us will interview you. drsamaditv.com. Have a wonderful week.
Thank you,
You too, and take care of those beautiful kids.
Thank you.
We'll see you soon. Thanks again.